This video demonstrates how to use the Avanos gastrointestinal anchor set with Saf T Pexy T fasteners. The Avanos gastrointestinal anchor set with Saf T Pexy T fasteners is intended to affix the stomach to the anterior abdominal wall, facilitating primary placement of the Avanos Mick and Mickey brand enteral feeding tubes. The Saf T Pexy T fastener consists of 3O Biosin synthetic absorbable sutures, preloaded safety needles for one-handed T-bar deployment, and a low-profile external bolster bumper designed for patient comfort. Place the patient in the supine position. Prep and sedate the patient according to clinical protocol. Ensure that the left lobe of the liver is not over the fundus or the body of the stomach. Identification of the medial edge of the liver by CT scan or ultrasound may be helpful. Glucagon 0.5 to 1.0 milligram IV may be administered to diminish gastric peristalsis. Insufflate the stomach with air using a nasogastric catheter until adequate distension is achieved. Choose a catheter insertion site in the left subcostal region, preferably over the lateral aspect or lateral to the rectus abdominal muscle, and directly over the body of the stomach toward the greater curvature. Using endoscopy, fluoroscopy, or laparoscopy, choose a location that allows as direct a needle path as possible. Place a skin mark at the tube insertion site. Define the gastropexy pattern by placing 3 skin marks equidistant from the tube insertion site and in a triangular configuration. It is recommended to perform a 3-point gastropexy that approximates an equilateral triangle to help ensure secure and uniform attachment of the gastric wall to the anterior abdominal wall. Allow adequate distance, approximately 2 centimeters, between the insertion site and the Saf T Pexy placement to prevent interference of the anchor set and feeding tube balloon once inflated. Prep and drape according to facility protocol. Maintaining proper stomach insufflation is critical to preventing T-fastener placement through the posterior gastric wall. Administer local anesthetic to the planned puncture sites as per hospital protocol. Carefully remove the preloaded Saf T Pexy device from the protective sheath. Note that the suture is held to the needle by a retaining snap on the side of the needle hub. Attach a Luer slip syringe containing 1 to 2 milliliters of sterile water or saline to the needle hub. Under fluoroscopic, endoscopic, or laparoscopic guidance, insert the preloaded Saf T Pexy slotted needle with a single sharp thrust through one of the marked corners of the triangle until it is within the gastric lumen. The simultaneous return of air into the syringe and visualization confirms correct intragastric position. After confirmation of correct position, remove the syringe from the device. Release the suture strand. Bend the locking tab on the needle hub. Firmly push the inner hub into the outer hub until the locking mechanism clicks into place. This will dislodge the T-bar from the end of the needle and lock the inner stylet into position. Withdraw the needle while continuing to gently pull the T-bar until it is flush against the gastric mucosa. Avoid having the T-bar exert excessive tension onto the gastric mucosa. Discard the needle according to facility protocol. Gently slide the suture lock down to the skin surface of the abdominal wall. A small hemostat may be clamped above the suture lock to temporarily hold it in place. Repeat the procedure until all 3 anchor sets have been inserted in the corners of the triangle. After the 3 Saf T Pexy devices are properly positioned, gently pull on the sutures to oppose the stomach to the anterior abdominal wall, avoiding exerting excessive tension on the sutures. Close the suture lock with a supplied hemostat until an audible click is heard, securing the suture. Any excess suture length may be cut and removed. Inspect the stoma and gastropexy sites daily and assess for signs of infection, including redness, irritation, edema, swelling, tenderness, warmth, rashes, purulent or gastrointestinal drainage. Assess for any signs of pain, pressure, or discomfort. Routine care should include cleansing of the skin around the stoma site and gastropexy sites with warm water and mild soap, followed by thorough rinsing and drying. The sutures may be left to be absorbed, or they may be cut when deemed appropriate by the placing physician. Letting the sutures be absorbed or cutting them will allow the T-bars to pass through the gastrointestinal system. After the sutures dissolve or are cut, the suture locks may be removed and discarded. It is recommended not to cut the sutures within 2 weeks post-procedure. Note that absorption of the suture is essentially complete within 90 to 110 days. Caution: if performing an early replacement gastrostomy within the first few weeks after initial Saf T Pexy placement, verify that the adhesion of the gastric wall to the interior abdominal wall is established and maintained. Consider use of an additional T-fastener to ensure proper early replacement of gastrostomy. If you need more information, reference the IFU.